Hey everyone, my name is Dr. Soren Paape, one of the owners of Smile Now Dental Group. If you're researching full arch tooth replacement options, you've probably come across all-on-4 or all-on-6 dental implants, and you'll probably are a little bit confused of what the difference between an all-on-6 or an all-on-4 is versus a snap-in denture. And how do you know which one is right for you? So in this video, we're going to talk about both options, break down the key differences, and help you to determine which one best fits your needs. Plus, I'll share with you how we at our office create a personalized treatment plan for you to ensure the best results for our patients. So first, let's talk about all-on-6 dental implants. And if you're unsure of the difference between all-on-4, all-on-X, or all-on-6, I like to use the term all-on-6 because at our Smile Now clinics, that's typically what we're doing. 6 implants, trying to maximize the amount of teeth and minimize the cantilever or the distance off of that last implant. Essentially, we want 0 cantilever because it's the best for the prosthetic. But all-on-4 just means on 4 implants, and typically those have a larger cantilever, a little bit worse for those front implants versus 6. But it still is a viable solution. Now, this is a permanent full arch solution that replaces an entire set of missing teeth using just 4 to 6 strategically placed dental implants. And again, at Smile Now, we are typically doing 6 implants when we can. These implants act as anchors for a full set of teeth, and this provides you a fixed, non-removable solution that looks, feels, and functions just like natural teeth. These don't have any adhesives, no slipping, no dentures falling out of your mouth when you're talking to your friends. It'll restore your full chewing power, it'll feel natural and secure, and it will give you long-term durability that a lot of you, if you have dentures currently, are having issues with. With all-on-6, your teeth are going to stay in place 24/7. You're going to be able to eat, speak, and smile confidently without worrying about those moving or falling out. And don't get me wrong, it is embarrassing when you're talking to somebody and that denture falls down. I'm well aware of it. A lot of my patients come to see me because they're sick of stuff like this happening. Next, let's talk a little bit about snap-in dentures. So we went over all-on-6, all-on-4. Snap-in dentures are also known as implant retained dentures, and these are removable options. So these come in and out, and these attach to dental implants. Unlike traditional dentures, they offer improved stability because they snap, they click in to these posts that are in your jaw, those implants. These are much more secure than traditional dentures. They're also easy to clean because you take them off, you can clean them, and they're a little bit more affordable than all-on-6. These are probably some of the pros. However, since snap-on dentures are removable, they still require maintenance. You need to take them out, you need to clean them, you typically need to get adjustments. They do wear faster because they are acrylic, so I would not expect that denture to last. And you also need to know that you will be paying yearly for the snap-in fixtures to allow that snap to stay durable. Just to recap, how do all-on-6 dental implants compare to snap-on dentures? I want to just give you a quick breakdown. So stability and function, all-on-6 is a permanent fixed treatment option, while snap-in dentures do need to be removed daily. All-on-6 offers nearly full chewing ability, while snap-in dentures provide about 50 to 60% of your natural bite force. All-on-6 feel like natural teeth. They're thin. There's no palate on the top of your mouth, while snap-in dentures can feel a little bit bulky or require adjustments, like on that bottom. I do want to let you know that at our clinics, we do not offer upper snap-ins. And the reason why is I have had to fix so many of these cases. Your upper, this is called your maxilla, your upper maxillary arch, the bone up there is quite a bit softer than your lower arch down here. When you're constantly taking that in, out, it's not great for those implants long term, and I see a lot of failures happen with upper implants. So we choose to not do those at our clinic because I'm fixing these from other clinics all the time, and I don't want my patients to go spend a chunk of money and not have it last a long period of time. For maintenance, all-on-6 only require regular brushing and flossing with water pick under it, while snap-in dentures must be removed, washed, and put aside at night. All-on-6 implants are designed to last decades, while those snap-in dentures, they do need to be replaced. The snap-ins need to be replaced, and the acrylic typically needs to be replaced every 5 to 10 years. Snap-in dentures do tend to be more affordable up front, But All on 6 does provide a long-term investment, and you're not needing to be paying yearly for new dentures or new snap-ins. So both options have their pros and cons, and the best choice really depends on what your individual needs, budget, and lifestyle are. At Smile Now Dental Group, we know that every patient is unique, and this is why we offer personalized consultations to help you decide what treatment option is best for you. This is exactly how we make this process easy for you. We're going to take a CT scan at our free consult, and we're going to evaluate your bone health, your oral condition, and your lifestyle to recommend the best treatment for you. We're going to break down all the costs so that you know upfront exactly what to expect, and there's no hidden fees at all. Whether you choose All on 6 or snap-in dentures, we create a plan tailored to your needs and budget. Our goal is to help you find the most comfortable, functional, and affordable solution for your new smile. So if you're considering All on 4 or All on 6 dental implants, you're more than welcome to call us, schedule a free consultation, and you can come into our office and see one of our providers. Again, I'm making these videos to try to help you wherever you get your treatment done. But if you do want some sort of implant treatment and you have a Smile Now office near you, we would love for you to come in and at least meet our providers to see if there's something that we could do for you. Again, if you have any questions at all, I'd love to help you out. Please leave a comment down below. We will be answering these questions. You can also reach me directly on Instagram or give our office a call, and I'm happy to chat with you. Thanks so much for watching. Bye.